Good evening, and thank you again for joining our webinar tonight, Combating COVID-19 Through Contact Tracing with the UH College of Medicine. I'm Kendra Hackinson. I'm a Program Director for Alumni Relations. We're going to get started, but just a few housekeeping items first. If everyone can please keep their microphones on mute to avoid background noise, and also if you'll use the speaker view, it'll give you the best viewing. You can put questions or comments in the chat along the way, and we'll do our best to get those addressed. And then lastly, I wanted to make sure you're aware of our upcoming webinars. We have an at-home cocktail class called Cougar Spirits, led by our friends from Toledo Creek and Gulf Coast Distillery. That's next Tuesday, July 28th at 6 o'clock. You can find more information in the ingredients list that you'll need and registration at houstonalumni.com/webinar. And then you also may have seen our recently announced alumni town hall with UH President Renu Couture for Monday, August 10th at 7 p.m. General registration will start next week, but if you're a UHAA Life member, you should have received an early access email today. And if not, you can send us an email to alumni@uh.edu, and we will get that squared away for you. So I wanted to introduce a couple people for our webinar today. We are honored to have Dr. Stephen Spann on for a brief overview of the College of Medicine. Dr. Spann, a family physician leader, educator, and researcher, is currently founding dean of the new College of Medicine and vice president for medical affairs at the University of Houston. And then we also have Dr. LaChauncey Woodard, who is director of the Humana Integrated Health System Sciences Institute at the University of Houston and a University of Houston College of Medicine professor. And then our last speaker is Dr. Bettina Beach. She is Associate Provost for Planning and Strategic Initiatives and Professor and Associate Dean for Research at the UH College of Medicine. So doctors, I will hand it over to you all.
Well, good evening. It is great to be with you. I'm Steve Spann. I am the founding dean of the University of Houston College of Medicine, and we're excited because this week we formally opened our College of Medicine with our inaugural class. Our 30 students of our inaugural class are on board. We started on Monday. Now, most of the activity has been virtual because of the COVID pandemic, but we are just delighted and excited to have our first class on board. Our faculty has been working hard for the past 2 years to get all the details in place, and we are finally launched and so excited about that. I wanted to tell you just a little bit about our College of Medicine and our inaugural class this evening. If we can go to the next slide. I wanted to share with you the renderings of our new building. Now, this new building is located roughly on the corner of MLK and OST. There's a 43-acre lot there that belongs to the University of Houston, and this will be the first building on that beautiful wooded piece of property. It's in front of McGregor Park. We've started construction on this, and it should be ready for occupancy within 2 years. It will be a state-of-the-art 130,000 square foot building, 3 floors, with the very latest in medical education, technology, and design. And we're very excited about being there. Now, in the interim, we have a beautiful interim facility in the Health 2 building over next to the College of Optometry. We have about 2.5 floors on that building. The top floor, the 9th floor, is the main educational space area. We designed it, built it out, and it is absolutely beautiful space for our first 2 classes. Our first 2 classes will be in that space until we enter our new building in 2022. And when we move to the new building, we will move from 30 students per class to 60 students per class for 2 years. And then after that, 120, which will be our final class size. Let me just show you the next slide, which it talks about our mission. You know, we say that we have a societal mission. We say that we're accountable to society for improving the health and the health care of our population, focusing on Greater Houston, our state, and even beyond. There are four components to our mission. The first is simply training doctors, educating physicians. We talk about educating a diverse group of physicians. We'll talk more about that in a bit. To provide compassionate, high-value health care. High value means cost-effective care, excellent care at reasonable costs. Patients, families, and communities, with a focus on training primary care doctors and other needed physician specialties. We really need more primary care physicians in our state and nation, and our goal is that 50% of our graduates would choose primary care careers. We also are part of a Tier 1 research university, and so we are committed to conducting interdisciplinary research, working cross disciplines on campus to find innovative solutions to problems in health and healthcare. We also talk about the fact that we will be or are in the healthcare delivery service. We have our faculty and soon to be our students providing healthcare in our community. We talk about it being integrated, evidence-based, and carried out by interprofessional teams. Our training model is one where we train physicians and nurses and social workers and pharmacists and so forth side by side, because healthcare is a team sport. And then finally, our focus on really working with surrounding communities, communities that have significant health disparities, to work together to improve health in a collaborative, engaged sort of model. So that's a little bit about our mission. The next slide really tells us about our values. We've developed a set of values, shared values, to really establish a culture within the College of Medicine. We call the acronym RISE, and it stands for respect for one another and for all people. It stands for integrity in the way we communicate and the way we interact and the way we work together and the way we take care of patients. The S stands for servant leadership. We're here to serve the patient, serve our community. And finally, E stands for equity and the importance of equity really across all people, and equity in healthcare and in health. So let me just share with you the next slide, which tells you a little bit about our inaugural class. Now, we're very, very proud of this inaugural class. We had over 2,200 applications for 30 spots. Imagine having to sift through those. About 1,700 of them met all of our requirements and were eligible for in-depth review. Out of those 1,700, we chose about 10%, about 170 to interview. Now, most of our interviews had to be done online because of the COVID pandemic. But out of that 170, we offered 41 individuals positions to fill with 30 members of the inaugural class. So some had already accepted positions elsewhere, decided they wanted to go elsewhere, but we chose, we got 30 out of the 41 that we offered positions to for our inaugural class. Now look at some of these statistics. They're all Texans. They're all from Texas, which we love, of course. 73% of our inaugural class comes from underrepresented members in medicine. Now, we didn't go out and say, well, we're going to recruit X quota of underrepresented members. We said, you know, we want to get folks who meet our mission. And we're delighted that 73% of those come from underrepresented members in medicine. 63% female, that is about average for medical schools across the country. There are more women in medicine and medical school classes than men these days. I think that's a great thing. And notice that 57% of our class are first-generation college students. That is amazing. That is wonderful. and they're going to be great physicians and provide great care. 40% of them actually come from low socioeconomic backgrounds. We think that's great too. We need more diversity in our medical school classes, people from all walks of life. We're interested in our graduates working in underserved areas, and we're just delighted with this class. They come from a number of different universities. The most represented university is UT Austin, not because we selected UT students on purpose, but they have the largest pre-med class in the state. Two from the other universities you see. But overall, an excellent class. We're just incredibly excited to have them. They're off and running, and we look forward to teaching them over the next year. We think that a fair amount of our instruction will initially be virtual online. We're fully prepared for that. Some of the experience will be in person. You can't learn anatomy, just on a computer screen. You have to see it in 3 dimensions. You can't learn how to examine a patient just on a computer screen. But initially, at least some of the instruction, a fair amount of the instruction will be online. But they will do well, and we're excited about having it. Well, you're going to hear about our contact tracing courses, and I'm really excited about this. As the COVID pandemic was coming about, we knew that an important measure to control epidemics is to trace the contacts that might have been exposed to an infected individual and to put those people in quarantine so that there's not a chain reaction and spread. And I am just delighted that Dr. Bettina Beach, Dr. Chauncey Woodard stepped up to the plate and helped us design initially a course that was internal to U of H, an online course. We had over 2,000 people register for that course. And then we were able to put it on Coursera, which is in the public domain so that people outside the university could learn about contact tracing and other aspects of COVID-19, and we've had a huge response to that as well. So let me just pass the microphone to my colleagues, Drs. Woodard and Beach, and let them tell you about this really neat effort of our College of Medicine.
Thank you so much, Dr. Spann. We appreciate that overview of our incoming class in our College of Medicine. As Dr. Spann mentioned, we're very excited for the students that we've welcomed, and we look forward to opportunities for you to get to engage with our students and our faculty here at the College of Medicine. We were asked to join you this evening to share some information about contact tracing. As Dr. Spann mentioned, we've developed 2 contact tracing courses with actually additional courses being developed for specific populations. And why this is really important is back to the mission that Dr. Spann explained. It really is our mission to engage with our community and to provide the resources that are necessary to improve the health of our community. So contact tracing and developing this curriculum and making it available free to our university community, and then also in the public domain, is one way that we at the College of Medicine are helping to contribute to stopping the spread of COVID-19. And so this evening, we're going to share some information with you about COVID in general and the specific demographics that are being impacted here in Houston, and then about contact tracing and our courses that are available to you. So this first slide just shows the history of epidemics and pandemics, and I won't go through all of it, but I did want to sort of make reference to the Spanish flu, which is what you see from 1918 to 1920. The Spanish flu was an influenza pandemic, and it impacted 500 million individuals worldwide, and 50 million individuals across Europe, the Americas, and Asia died from the Spanish flu. And so, as you will notice, pandemics and epidemics have been a part of our history in the 20th and 21st century, leading all the way to the current COVID-19 pandemic that we are experiencing. So as we go through the next several slides, I'll share some information nationally, well, first of all, I'll share some information about the impact of COVID worldwide, but then we'll drill that down to our local Houston community and provide some information for you about how the COVID-19 pandemic is impacting our city, our state, our country, and the world more broadly. So before we do that, one of the things that we want to share is really lessons from history. And so what we know from history when we think about pandemics is that cities and modern ways of living have produced the conditions that are both necessary for pandemics to emerge and for pandemics to be controlled. So while we're experiencing a pandemic currently, I think it's important to realize that we have the tools and techniques that we need to help control the pandemic, and contact tracing is one of those. And as I mentioned, we'll share some of that with you this evening. And it's important to also remember that these sorts of outbreaks always present challenges, but we are resilient, we are adaptable in the face of uncertainty. And certainly if we come together as a community and focus on our shared human experience, together we can mitigate the spread of COVID-19 and bring the COVID-19 pandemic to an end. So this just shows you a rendering of our entire world, and you will see this frequently. This comes from Johns Hopkins University, and they publish a lot of the numbers related to COVID-19. And so one of the things that this demonstrates is that COVID-19 has really impacted the entire world. There are very few areas that have been spared from COVID-19. And as a result, there have been more than 15 million confirmed cases of COVID-19 worldwide. Specifically in the United States, you'll see where that pink circle is. You can see that COVID-19 has really been widespread throughout the United States, impacting almost every area of our country. The United States has nearly 4 million cases of COVID-19, and so we are the country with the most COVID-19 cases worldwide. The closest country following the United States is Brazil, and they have approximately 1.8 million fewer cases than we do. So as you can see, the United States really leads the world in the numbers of COVID cases. And unfortunately, of those who've been infected with COVID, 143,000 have died. That just highlights the importance of engaging in these public health measures that can help to stop the spread of COVID-19, particularly as we wait for therapeutics to emerge, specifically vaccines, and as we continue to develop an understanding of treatments that can impact the course of individuals who are infected with COVID-19. So this is a map that drills down in the United States, and I show you this map to really have you focus in on Texas. One of the important things to recognize is that we have a lot of work to do here in Texas. We in Harris County are the county that has the 7th most COVID-19 cases in the nation. So in Harris County, we rank in the top 10 of COVID-19 cases. And so that just demonstrates the work that we as a community have to do. And hopefully you, through this presentation, will see how contact tracing can be a part of the solution. So this is data from the Texas Medical Center, and the Texas Medical Center publishes daily infection rates in the greater Houston area. And so I would highlight for you that the stay-at-home order in the state of Texas was ended at the end of May. And so as you can see, since that time, we've seen a steady increase in the number of COVID-19 cases in our community. To date, we have almost 83,000 total cases. And so when we look at this, it just helps to, again, highlight the need for strategies that can mitigate the spread, like social distancing, like wearing masks, like having sufficient testing, and of course, engaging in contact tracing. I wanted to share some specific demographics with you about certain populations in our area. And one of the things, you've heard a lot about this on the news, but one of the things that I think is really important to remind everyone of is that actually, we're seeing the greatest prevalence of COVID-19 in individuals between the ages of 20 and 40. And this is important because oftentimes you will hear that younger individuals are not as severely impacted by COVID-19. We have certainly seen some individuals who've had very severe illness from COVID-19 who are in this age group, but oftentimes individuals in this age group may be some that are asymptomatic. And so it's important to remember that individuals in this age group are the ones who are more likely to be out and about. They may be some of us, and we're the ones who can also be spreaders. So when we think about, you know, individuals who will potentially expose their parents and grandparents, they tend to fall in this age group. So it's important to really understand where we see the highest number of cases and the potential for individuals, even if they're asymptomatic, to spread COVID-19. One other statistic that you've probably heard is the way COVID-19 is impacting lower socioeconomic groups and communities of color. And so within our community, we're a very diverse community, but you will see that it is the Latinx community that is bearing the most disproportionate burden of COVID-19. And I think this highlights the importance of some of the data that Dr. Spann shared with you about our inaugural class. It's important that when we're thinking about addressing specific health issues related to underserved communities, that we have individuals from those communities who have the trust of those communities to help to work with those communities to deliver culturally tailored education, and to also, as we think about contact tracing, be able to have that community trust so that we can get the most effective information that we need to help stop the spread of COVID-19. So this slide shows you a little bit about how COVID-19 is transmitted. Importantly, we know that COVID-19 is transmitted by respiratory droplets, and there's also some evidence now that COVID-19 can remain in aerosolized form. And so that's why you hear a lot about how having groups that are contained in indoor environments can lead to increased spread of COVID-19, because COVID-19 droplets can remain in the air, they can land on objects and surfaces. When you touch those surfaces and then subsequently touch your face or your nose, mouth or eyes, you can then become infected with COVID-19. And so that's why you hear about the importance of wearing masks, because when we wear masks, we tend to contain those respiratory droplets to ourselves, and then also social distancing. So that way, if you are in an environment where someone may cough or sneeze and you are at risk for COVID-19 transmission, that is less likely to occur if you are socially distanced. So these are just some of the very common symptoms that we see with COVID-19. As you'll see noted on this slide, we reference the CDC website for a full list of symptoms of COVID-19. It's important to remember that information on COVID-19 is continually changing. So information that is up to date today is likely to be out of date next week. And so these were the most prevalent symptoms that we saw when the COVID-19 pandemic started. But now there are several other symptoms that are on the CDC list of symptoms. And from colleagues who are practicing, as well as myself, one of the most pathognomonic symptoms of COVID-19 is loss of smell or taste. Almost 100% when we see someone come in with those symptoms, we end up diagnosing them with COVID-19. So just a reminder that the symptoms of COVID-19 are continually evolving, that we're continuing to learn about COVID-19, and it's important to reference reputable websites that are grounded in science as you seek information about COVID-19. As I mentioned earlier, when we talked about younger individuals where COVID-19 is most prevalent, asymptomatic individuals, or those who just have mild symptoms who are in the early stages of disease, can certainly spread COVID-19. And in fact, there are some literature that shows that these individuals may in fact be the most infectious. So it's important to remember that you can still catch COVID-19 from someone who's infected but has no symptoms, or one who just has a slight cough or doesn't really feel ill. And this highlights the importance, I think, even more of contact tracing. And so we'll share with you a little bit of how contact tracing works and help to put all of this in context with regard to how contact tracing can help to slow the spread of COVID-19. So this is just an overview of contact tracing. Contact tracing is a long-standing public health tool that's been used to investigate communicable diseases and to stop their spread. So even though we're hearing a lot about contact tracing, it's been used throughout history to stop the spread of transmissible diseases. In particular, we think about things like HIV or foodborne illnesses or other sexually transmitted diseases or tuberculosis. Those are common places where we used contact tracing historically. Contact tracing is the process of identifying individuals who may have come into contact with someone who's been infected with COVID-19. Once you identify those individuals, it's important to collect additional information about all of the potential contacts of someone who's infected with COVID-19, because that allows you then to provide guidance to those individuals about what they need to do as far as seeking treatment, testing, quarantining, or isolating if that's necessary. So as I mentioned, contact tracing isn't new. It's a long-standing public health tool that's been used to manage infectious diseases. One common area where you may have heard of contact tracing being used is in foodborne illnesses. So oftentimes we'll hear of infections that arise from foodborne illnesses like E. coli. Well, the way that people are able to identify the source of those infections and then to prevent spread is through contact tracing. Despite the importance of contact tracing and the fact that it's been something that's been used in public health for a very long period of time, what we found in light of the COVID-19 pandemic, particularly as communities have tried to shore up their contact tracing workforce, is that there really are no national training standards for contact tracing. So you'll notice that there have been several courses, if you go on Coursera, that have been developed with regard to contact tracing, including our own. In spite of having these different resources, what we know is that there's not any sort of national standard for these. And I think that makes it much more difficult for communities and states and our nation as we try to stand up a contact tracing workforce to be able to do that. So this just highlights an article that Dr. Beach and I collaborated on that really evolved from the work that we've done with our colleagues here in the College of Medicine and throughout the University of Houston in developing these contact tracing curriculums. It really highlighted for us that there are no national standards and inspired us to really think about what needs to happen in order to establish those so that in the face of this current pandemic or future epidemics or pandemics, we have the information that we need to be able to more efficiently stand up a contact tracing workforce. So again, what is contact tracing? Well, if you think about contact tracing, what it is really in the name. A contact is somebody who's been in contact or physically interacted in some way with someone who's been diagnosed with COVID-19. So they've been exposed to an individual who has been found to have COVID-19. When we engage in tracing, we're really working to identify all of the connections between people who have come into contact with a person who's been diagnosed with COVID-19. Once you have identified those individuals, the next step in contact tracing is to identify all of the contacts and notify them of their status so that, again, they can be tested if necessary, they can quarantine or isolate based on what information is gathered by contact tracers. So this slide provides a quick overview of contact tracing. Again, we hear a lot about contact tracing, but sometimes I think it's helpful to really see what contact tracing is and how it works. So if you look at this slide, you'll see that there's a confirmed case of COVID-19 in the individual at the top left. And so that person is then required to be in isolation and to receive care if needed, depending on their symptoms. Once you identify that person who's been confirmed positive for COVID-19, a contact tracer reaches out to that individual to find out about all of the individuals that they may have been in contact with. And the way they do that is to ask a series of questions that help to identify where you've been. Did you go to church? Were you in any sort of family gathering? Did you go to a restaurant or to the barbershop? And when they get that information, they then seek to identify the individuals who this person may have been in contact with in those various settings. Once they do that, you'll find that some individuals who are the contacts can then be reached. And if a contact is showing symptoms or tests positive, then that person becomes a confirmed case, and the whole process of contact tracing starts again with those individuals. Other individuals who may have been exposed and are contacts may not have symptoms and they may be tested and may not in fact be positive. And if they have no symptoms or have gone through an incubation period, then they're not at risk of developing a disease, and there's no need to further continue the cycle of contact tracing. If you identify someone who's been exposed to somebody with COVID-19 and you talk to them and they don't have any potential contacts, then that person needs to quarantine or isolate, but there are no other contacts. And you can see how that then stops the spread of COVID-19. There will always be individuals that we miss, and those individuals may in fact be positive and be able to spread COVID-19 to others. But you can see how being able to identify someone early on who's been exposed, get them testing, and then make sure that they isolate or quarantine as appropriate can be very effective in stopping the spread of COVID-19. So despite all the benefits of contact tracing, we know that there are several barriers that we're seeing with regard to contact tracing. Some of those are highlighted here. One of the biggest barriers is testing delay. So I'm sure that many of you, like myself, have heard on the news about individuals who are being tested but can't get their test results. So if an individual is not able to get their test results, it's very possible that during that time period, they assume, well, I don't have any test results, I'm not symptomatic, so I must be okay. They could be asymptomatic carriers who are then spreading COVID-19 within the community. Another challenge that contact tracers are facing is that people aren't answering phone calls. When you get a phone call from someone you don't know, many of us don't answer those calls. So people are not answering phone calls. And then, as I mentioned, the importance of cultural context and other information that allows you to develop the trust of the community are very important. If communities don't trust contact tracers, they're going to be less likely to provide the information that's needed to stop the spread of COVID-19. And finally, when we talk about trust, some of you may have seen the push to use more technology in contact tracing, but what we found is a lot of people have been very resistant to that. And it's required us to then continue to use some of the tried and true methods of contact tracing, which are really individuals who are contacting other individuals, making that human connection and getting the information that's necessary to, again, identify contacts and try to slow the spread of COVID-19. Some other problems that we've seen is that we're just not able to keep up with the pace of reopening and the rapid increase in the number of COVID-19 cases. So when our numbers were low before the state reopened, that was a time where if we had tracing, a contact tracing workforce and had adequate testing in place, that contact tracing really could have been effective in identifying individuals, isolating them, and stopping the spread. Unfortunately, where we are now requires that we do some of these measures like social distancing, like wearing masks. Potentially some places have talked about, again, shutting down again, but those things that can then reduce the rate of community transmission, thereby allowing contact tracing to be more effective. Another thing, as I mentioned, that we've seen is that certain communities are even more mistrustful of contact tracing and the information that they're sharing. And so overcoming that mistrust is important. And then I highlight one article because we have had a lot of conversations ongoing about opening schools, and certainly concerns with the high rate of community transmission that we have. Some school districts choosing to open virtually. We've seen some teachers unions saying that they don't feel like we're ready to reopen, particularly as we have this high rate of transmission in our community. And this particular article that I highlight discusses the importance of contact tracing and testing as a means for being able to safely reopen our schools. And finally, I share this with you. There was an article in the Chronicle that talked about Houston's surge of COVID-19. And as you'll recall, when we began to need to develop a contact tracing workforce within the state, we had a goal of hiring 4,000 contact tracers. We've still not met that goal. So if you think about that and then you put it into the context of the surge of COVID-19 cases, you can see how a contact tracing workforce that has to reach out to all of these different individuals could easily become overwhelmed. And this just highlights again the importance of us doing the things that we need to do to reduce community transmission so that contact tracing can be effective. So one of the ways that the University of Houston College of Medicine, and really the University of Houston more broadly, because we had collaboration on this effort across several colleges here at the University of Houston in this effort that was led by the College of Medicine, is to help to train a contact tracing workforce. And so we've had several iterations of our contact tracing course. The first was one that was offered locally within the University of Houston community to faculty, staff, and students. And importantly, one of the things that we think is fun to highlight about this is that the entire University of Houston police force completed contact tracing so that they could then be that important contact tracing workforce that we need here within our university community as we think about fully reopening the University of Houston. In addition, there was really a need to have this information available outside of our University of Houston community. And so we worked with our public health authorities locally to develop a population health during a pandemic course that's now available on Coursera. Coursera included our course with a suite of free courses that are available with regard to COVID-19. And so we've included the link here. Also, if you go to the University of Houston College of Medicine landing page for this course, you will have a link that will take you to Coursera. You have to go through the special link that leads you to the promo page, but if you do that, you're able to complete this course for free through July 31st. And both our internal course and this course offer a certificate demonstrating that you've completed this course. And so certainly we developed this in hopes that individuals who take this course will be able to go out and become a part of the necessary contact tracing workforce, either in paid positions or in volunteer positions. And certainly we've seen that there was a big uptake within our University of Houston community and our students who want to be a part of the solution in thinking about COVID-19. So we would be remiss, even though this presentation was about contact tracing, if we didn't continue to emphasize the important steps that need to be taken in order to reduce the spread of COVID-19. One of our colleagues at Baylor College of Medicine, who is a world-renowned expert in vaccine development, was quoted as saying, Houston could become one of the worst affected cities in the United States if we're not able to, again, think about what we're doing as a collective to slow the spread of COVID-19. So safety first, remember to do the different things that can help to stop the spread of COVID-19. So there are things that we can do as individuals, and there are things that we can do as a collective community, and it's important that we're engaging in both of those things. So of course, avoiding close contact with individuals who are sick and staying home if you're sick, covering your cough, wearing a mask, avoiding touching your mouth, eyes, and nose, making sure that you're disinfecting surfaces, and then washing your hands or using an alcohol-based hand sanitizer. In addition, we've seen a real push for us to use masks, and many businesses are requiring masks. And we're seeing more mask mandates across the country. So while this is something that seems to have caused a tremendous amount of controversy, we know that the science shows that masks are effective in stopping the spread of COVID-19. And finally, we leave you with some resources. We'll be happy to provide these to Kendra if you're interested in learning more about contact tracing. In particular, I would highlight the Texas Medical Center updates that have some of the information about daily case counts, ICU bed availability within our community, and then also our public health and city websites, which have information about where you can get tested, and also educational materials about COVID-19. And again, we encourage you to use these resources that are from trusted and reliable sources, because certainly we are all important in spreading information about COVID-19 that is accurate and that will, again, help us to hopefully see a slowing and eventually an end to this pandemic. And so with that, I will stop. Dr. Beach is also on the call and presenting this content along with me. And so I will stop to see if she has anything she'd like to add. And also she's been moderating questions that you all may have submitted. So we'll answer those questions and then also open it up for questions from anybody who would like more information about what we've presented or just have questions in general about COVID-19.
Thank you, Dr. Woodard, and thank you, Dr. Span. We've only had one question so far, and that was about the length of the Coursera course. It's a self-paced course. Coursera lists it as a 22-hour course. It does not take 22 hours. That amount of time is just to convey the quiz time that they calculate at about 30 minutes per quiz. So we really calculate about 15 to 17 hours, but it's self-paced, and so you can complete that course in a shorter period of time. And the course is for anyone, for the general public, so it's on the Coursera platform, which is, again, open to anyone in the general public, not just for alums. And it is free for anyone through July 31st. We're waiting to see if there might be an extension of that, but as of today, it's July 31st. It is the UH course. The Johns Hopkins course is a 5-hour course that's on Coursera. Both of our courses cover contact tracing, but as you can see from what Dr. Woodard provided, the information that our course is embedded in a larger infrastructure in the milieu of what COVID-19 is, what is the latest vaccination, testing data, looking at kids and pregnant women, as well as mental health issues. So ours is a larger context around population health as well as how to do contact tracing. I'm going to try to keep up with your questions here. I love it. Is there a certain time frame to complete the course? No, it is self-paced. So you can complete it in the amount of time that it takes you. So there's no pressure whatsoever. In terms of after completing the course, there are still health departments that are looking to hire contact tracers. Sometimes they contact us there, but we are not placing individuals as contact tracers, but there is certainly information available at the county health department, local public health departments. There are corporations that are hiring contact tracers. So there's a variety of places where they are being hired. Yeah, the best way of getting a job after completing is to, again, contact health departments. That's the primary place where contact tracers are hired. But again, there are corporations that are looking, and we've been contacted as well. Okay, yes, you can reside anywhere. We have learners from Alaska that are in our course. So in terms of working as a contact tracer, though, because you're dealing with sensitive information, the work is done at a health department. So you cannot be at home and have access to sensitive data and work from home. So you are working at a health department, much like the photos showed. So you can apply in another city, but you're going to be working in person. You do have to complete the course before, you have to enroll in the course before July 31st. You can start it, but finish it after that in order to get it free. Again, we are hoping that no cost will be extended, but as of today, it's still just till July 31st. So thank you. I think I kept up with your questions, but I'm happy to answer any others.
So thanks, Dr. Beach. We're also happy to answer any questions that you might have about our new College of Medicine and our inaugural class. We're super excited about that. So if you have any questions about that, please feel free to add those to the chat or just say them out loud.
Yes, go Cougs. Absolutely.
Definitely. I'm an Aggie, but I'm learning how to do the Cougs sign.
Yes, we have to make sure that you're doing the right sign.
Exactly.
Yes, we have some information. Again, we have to be very careful because we're not in the position to place people, but very often we are contacted by organizations that are interested in hiring. Will we send the link to the class? So yes, I will leave this to Kendra to talk about the availability of the link. And access to the recording of this meeting. And there's a question here about what if we have found to be resistance to using technology and contact tracing. Yeah, so, and I'll ask Dr. Woodard to add too, privacy concerns are very real. And so it was interesting, I received a message from a colleague that my phone, my Apple phone, had the app already embedded that was loaded, that all I had to do was activate it. And so because you have GPS and there's information about where you are going, that's how contact tracing electronically works, some people have felt very concerned about hacks of data, who might have access to that information, how it will be utilized. And in other countries that have been very successful in using it, they've also had similar resistance. So there really is no substitute for humans, but we hope that the technology will also allow us to move that work forward, because as you can see, humans cannot keep up with contact tracing when the test results are lagging and it takes that long period of time. Anything else to add, Dr. Woodard?
No, I think you covered it. I think the big issues with contact tracing and apps, and I think when COVID-19 started, you heard about different potential apps that were being developed. I think, as Dr. Beach mentioned, people have just been resistant to use those because of the amount of information that would be available and concerns about that information and their privacy. And so there have been several things in the press that have talked about contact tracing apps and why they haven't been successful, and that's been the main reason. And so we've seen that there's been much reliance on the traditional ways of conducting contact tracing, which is individuals working with health departments and contacting individuals. The other thing about an app is quite often when you're doing contact tracing, the benefit of a contact tracer is that they can share information with the individual that they've contacted about potential resources that that individual may need. People who are being contacted and told that you've potentially been exposed to someone with COVID-19 may experience a tremendous amount of distress and need assistance in navigating the system, how to get tested, where to find potential resources. And so that is something that happens much more effectively when humans are conducting the contact tracing. And so we've also seen that as a reason why I think so far contact tracing has been more successful when it's been done by individuals. But I would second what Dr. Beach says. It's a lot, especially with the numbers that we're seeing in our community, to be able to track where everyone has been. And so certainly technology can play a role in helping us to do that more effectively. There's just the balance between that human interaction and also privacy concerns.
Yeah, there's a great question about culturally competent contact tracing, including language, dialect fluency. This is, I think, one of the major contributions that the University of Houston has had in working with the county and city health department, in that we've trained a diverse group of contact tracers. So multilingual individuals, folks that have had experiences in Houston, all contact tracing is local. We've been able to hire those individuals. We are also collaborating with our colleagues to have our contact tracing training program translated into Spanish, and we have been contacted by two government agencies federally about potentially utilizing our course, partly because we have included so much on racial and ethnic diversity, and Dr. Woodard actually led that module. So we definitely agree with you. This is an issue, but it's one that we are on top of. Yes, contact tracers are only tracing individuals in their general community. They are linked with health departments, and so as health departments have their frame of reference in terms of who they work with zip codes, that information is provided to them from hospitals, doctors' offices, that's conveyed to the health department, and so you're tracing in certain areas. Hence the need for so many contact tracers across the state, such as Houston, as Texas, that's so large. Yeah. So you've probably heard about a couple of other programs, Partners in Health. They worked in the Northeast. Johns Hopkins worked to build contact tracers for New York and New Jersey and Connecticut. So each region really had to build their own contact tracing workforce. And again, this led to Dr. Woodard and I really putting out a peer-reviewed scientific article calling for national standards, not only for contact tracing, but a national program for us to work across the states to be the United States and have an effort. So thank you so much. Ah, someone's registered. We love it. I hope you enjoy the course.
And as we wrap, I just, always like to highlight that this effort, although Dr. Beach and I have been really privileged to lead it, is one that reflects the efforts of our entire College of Medicine faculty, because we really built on the expertise of our faculty in OB-GYN and pediatrics and our mental health colleagues in developing this curriculum. And even when we thought about ethical issues and privacy issues, we had colleagues from the law school and the honors college who joined us. So this really
and social work.
And social work, yeah, and social work. So particularly about thinking about how we connect individuals to resources in our community. So I think that this not only reflects the mission of the College of Medicine, but also reflects the mission of the University of Houston, which seeks to improve the health of the community in which we reside and the broader Houston community. So.
Yep. Thank you all for joining us this evening, and we hope we've provided some helpful information. Back to you, Kendra.
All right. Thank you, everyone. Thank you, Doctor, so much. It's been very helpful. So as we mentioned in the chat, the recording will go out to all registrants, and it will be posted to our webinar website as well, so that we can all have access to it there. But if anyone else has any questions, again, you can email us at alumni@uh.edu. We can connect you with somebody that can help with those. But thank you all for joining very much. Hope you enjoyed it and learned something, and we'll address all of the questions as those come in if you have them. So everyone have a good night. Thank you.
Yep, stay safe.
Thank you very much.
Bye-bye. Bye.